Gather equipments, check medication order against the original physician's order according to agency policy, and then clarify any inconsistencies. Check the patient's chart for any allergies. And then know the actions, special nursing considerations, safe dosage ranges, purpose of the administration, and adverse effects of the medication to be administered. Consider also the appropriateness of the medication to the patient. And then perform hand hygiene. Prepare the medication for patient one at a time. And then read the MAR and select the appropriate proper medication from the patient's medication drawer or unit stock. And then compare the label with the MAR medication administration record, check expiration dates, and perform calculations if necessary. And then, when all the medications for one have been prepared, recheck the label with the MAR before taking them to the patient and return the medication stock for the patient's drawer. And then transport the medications to the patient's bedside carefully and keep the medications in sight at all times. Then ensure that the patient receives the medication at the correct time. And then we identify the patients by asking his or her name, or by doing to check the name band, or also ask the significant others if the patient cannot identify him or herself. And then perform hand hygiene. And then put on gloves. Assess the patient's skin where patch is to be placed, and then looking for any signs of irritation or breakdown. And then site should be clean, dry, and free from hair. Rotate application sites as per doctor's order. And then remove any old transdermal patches from the patient's skin. Okay. And then cut into half or fold the old patch into half with adhesive sides sticking together, and discard according to hospital policy. Gently wash the area where the old patch was with soap and water, and then ensure the gloved hand is thoroughly dry before holding the new patch. And then remove the patch from its protective covering. Write your initials and the date and time of the administration on the table side of the patch. And then apply the patch to the patient's skin. Remove the patch from its protective covering and then write the initials and labels and the date, time of administration on the label side of the patch. Remove the covering on the patch without touching the medication surface and then apply the patch to the patient's skin. Use the palm of your hand to press firmly for about 10 seconds. Do not massage. And then remove gloves and perform hand hygiene. And then evaluate patient's response to medication with appropriate time frame. And then document the procedure in the patient's chart.